This is going to be a 11-part series done by Chrissy, one of the instructors here at Southern Technical College. As you can see on that backboard, there will be 110 instruments. So if you're interested in basic surgical instruments, we're going to go over that in an 11-part series. I thank you for joining us, and it really is for us. If you can just like, subscribe, if you're interested in surgical technology, this is the place to be. But we're just going to jump right over to Chrissy, and she's going to go over these 10 instruments, very basic, and then progressively get up into more of those instruments. So if you're looking for some resources for instruments, you're at the right place. Let's hit it.
All right. So the first instrument for the day is the number 3 knife handle. One of the basic knife handles that we use, the most common knife handle that we use in basically any specialty, is the number 3 knife handle. Then we have the medium needle holder. Base uses for suturing, like the most common. There's longer ones, there are shorter ones. Medium needle holder. Then we have the ring forceps or the sponge stick. It's used to grasp, or it can be used to create a sponge that folds up in here, and it's used as a blunt dissection. Most commonly used, if they use it with a sponge, is for OBGYN. Then we have the suture scissors or straight mail, used to cut suture, used in basically any case to cut suture. So normal suture scissors. Then we have the Kelly or peon hemostat, used to grasp tissue, used to grasp suture, used as a tag for suture. Very common in any basic tray, you're going to have a Kelly. Then you have the Army Navy. It's a retractor, used to retract tissue, used in general surgery most commonly. Then you have the Adson with teeth. So what I tell my students is make sure you put on their quiz Adson with teeth, because we have 2 other Adsons that we use. It's used on skin for closing, delicate tissue, just to grasp tissue, but basically for skin. Then you have the malleable ribbon retractor, many sizes, many lengths, widths. Just bend it, create the retractor that you need it to be. Surgeon, I usually tell the students, make sure just let the surgeon bend it the way they would like it to be. Then you have the Alice grasper, quite often used on breast tissue, used in mastectomies, lumpectomies, lumps, bumps, general surgery. Then you have the cerebellar, self-retaining retractor, does it on its own. This one is a sharp. There's also dull. There's also larger ones, medium ones, and then there's even a smaller one than this. So, cerebellar retractor. All right, please join us next week for the next 10 on our series of 110 instruments that the students will learn in their Skills 1 class.